Law might be a British value, but is it always adhered to? Health professionals in Norfolk and Suffolk are claiming that managers are failing in their legal duty of care to mental health patients because of a shortage of beds. They've been taking part in a public consultation that's overwhelmingly opposed proposals to cut mental health beds in Waveney and Great Yarmouth. Here's Deborah McGarrett.
When he was at home, you feel like you have to cope. It's your husband, it's the person you love most in all the world. But to see them going bit by bit, knowing the man, how he was and how he became, is just absolutely awful.
Dementia has taken away her husband David, the man that Denise Day describes as her soulmate.
The police have found him on the railway line, which could have had such a disastrous result, and that's when something really had to be done.
Her one consolation is that David is now safe and secure nearby, and it's here at Carlton Court in Lowestoft where he receives his care. Last year, 2 12-bed wards here, Larkspur and Laurel, were closed, along with the Poppies Daycare Centre and the loss of more than 30 jobs. 3 12-bed wards for continuing care remain open. The question is, for how much longer? It's all part of the reorganisation of mental health services in Norfolk and Suffolk, where the Trust is trying to save £40 million over 4 years. A public consultation involving more than 1,000 people has reported claims that patient safety is being placed at risk and their legal rights infringed. The Clinical Commissioning Group is in breach of its statutory duty under the Mental Health Act, and mental health professionals can no longer fulfil their legal duty because of the shortage of beds.
In the consultation, they fed back exceptionally clearly that when they do an assessment and there is no beds available anywhere in the country, that means that they are unable to legally fulfil their responsibilities under the Mental Health Act. In the last couple of weeks, we've had people that we know have been admitted up to Harrogate in Yorkshire and also down as far as Brighton. It's not just a bed issue though, the issue is that our community services have been absolutely slashed.
A meeting on the public consultation will be held later this month and the final decision is due in September.
It's just like having this, dagger of Damocles hanging over your head. You're trying to put it out of your mind until you hear a decision, but how can you not think about it?
We're frustrated that Norman Lamb, the CCGs and the Board of the Mental Health Trust, who all have a part to play, all seem to kind of say it's somebody else's problem to sort out.
What would your message be to Norman Lamb about the situation?
Missing out the swear words, of course. But he's been reported in saying that it's intolerable that these things are happening. So why is he not doing anything about that? Instead of complaining and passing the buck, he's the one that has to say this has got to happen. Why are they saying you've got to save 20 million? People with mental illness or a disease cannot stand up and say, I want help. It's got to be up to us to find that help for them.
Well, earlier this week, our correspondent Alan Sodhi met with Norman Lamb and he asked the Minister why the closure of wards has coincided with a reduction in support in the community, which simply isn't adequate.
I tend to agree with that, and I've seen it myself as a local Member of Parliament, and I've taken up issues with the Mental Health Trust, and I have to say that I have criticisms of the Mental Health Trust about the way in which they have sought to achieve their reorganisation. It was highly unfortunate, I just put it no more than that, highly unfortunate that the Chief Executive who launched the transformation of their services chose himself to leave halfway through the process.
Do you acknowledge that some patients are having to travel much bigger distances and that is not good for both the patients and their families?
Yes, and I find it completely intolerable. If I was a family member of someone shunted off 200 miles away, I would feel as angry as anyone else. And I have made it clear from my position that this practice has to be challenged. It's not necessarily always the case that you need an inpatient bed. The progressives in mental health care are looking much more at alternatives like recovery houses. There are lots of third sector organisations providing brilliant resources to avoid the inpatient admission, to help someone cope with a mental health crisis, or just providing support for people at home.
Now, the response to this consultation will come next month. The decision will come in September. Can you give any assurance that there will be no further cuts in the number of beds?
Well, again, coming back to this beds issue, we've seen this significant reduction over more than a decade in the number of beds that are available, and it's right.
So does that mean there could be more cuts to beds?
Well, but only if it's right for patients. It's getting the care right for individuals. So let me try and make this point. Across the country, we see very variable lengths of inpatient stay, and the progressives in mental health believe that the average length of stay needs to come down significantly, getting more people support within the community. Much better early intervention, for instance, in psychosis, is something that everyone is calling for across the system.
But shouldn't you be getting the community part of it in place first before the beds are cut, not the other way around?
No, absolutely, and that's what the Mental Health Trust should be doing, and they should be working collaboratively with the commissioners. That's why it's really good that the commissioners in Yarmouth have been proactive in trying to understand the community needs and then working with the Mental Health Trust to ensure that those needs are met. I don't have total power as Minister to achieve what I want to see, but I will constantly, in the time that I have available between now and April 15, advocate the case for mental health.
It sounds like a bit of buck passing, that you don't have the power, that you will do all you can, you will do all the talk that you can, but the action won't necessarily happen.
I'm just trying to be honest with you about the things that I can do and that I can't do. I've intervened directly to get extra money from commissioners in Norfolk for mental health services. So there's no buck passing here at all. I will do everything I can within my power, but in a very decentralised system which has existed for many years, long before this government came into power. The decisions about allocations of funding are taken locally.
Norman Lamb, thank you very much indeed.
Thank you.
George Nobbs, you're there at the County Council. Had the Trust, the Norfolk and Suffolk Mental Health Foundation Trust, had they come to the County Council's Health Scrutiny Committee and run their plans past the committee before making the changes that they have?
I don't think so, because I think this decision, as you know, is not going to be taken until September. And
but the changes, the redundancies that have already been put in place, the beds that have already been
you're talking
closed.
about in Suffolk, I can't answer for Suffolk. There have been no cuts in Great Yarmouth yet, and that's what the consultation's about. But listening to Norman Lamb, it's like watching Pontius Pilate, washing his hands of this, wringing his hands and saying, "Oh, isn't this awful?" And but he's a health minister. I mean, we get this over and over again from Norman Lamb that I wish I could do something about it. It's all somebody else's fault. If he feels that strongly, then I suggest he either does something, or if he can't do something, he resigns. But to sit there endlessly saying, "Oh, this is terrible," but it's somebody else's
Russell,
fault.
do you want to comment on that?
I think that's extremely unfair, frankly.
It's true.
No, it's not. The situation is that there is not enough money going into mental health across the country. In the case we have here, if anybody's able to get underneath and kick backsides and what have you, I have confidence that Norman Lamb is the man who will do it. But as he quite rightly said, if you delegate authority down to local organisations, local health trusts, you must rely on them to do it. What this shows, Etholle, is that the huge medical advances in cancers, hearts, ailments and the rest of it, people are now surviving illnesses which in an earlier generation would have killed them. The unintended consequences, they are now later in life getting dementia, which they would never have had because they
let's
don't
talk
know.
about the practicalities of that. George Nobbs, the Norfolk and Suffolk NHS Foundation Trust has said, and I quote, "It aims to provide the most appropriate services to meet each patient's need, delivered wherever possible in people's own
but
homes."
they're
But
being forced-
people are being sent far away from
the
home.
fact they're having to face 20% cuts imposed by the health service, not by clinical commissioning groups, not by anybody locally, but by the government itself. Now, if you the 23% of people who present themselves to the health service are there with mental health problems, but mental health gets 11% of the national
So
budget.
something
There's
else
just
needs
not
to be
enough money,
done.
and there are cuts, and Norman knows there are cuts.
Well, more money is being spent on the National Health Service under the coalition government than it was under the last Labour government. And I accept there's an argument about how you cut the cake, but the cake is actually bigger.
Is it right, though, to send people hundreds of miles away from
course
home?
it is.
Or Russell?
No, of course it's not. But I think that comes down to a degree of local management, and we've got to get away. I thought we had got away with it, but clearly we haven't here, of the silo mentality, where one trust is looking after itself, and the unintended consequences, and another unintended consequence is if they don't have the beds for psychiatric people,
Okay.
it could tie up police officers in dealing with psychiatric
Very
patients.
briefly, if you're...
The great problem with mental health is that it's labour intensive. You can't make cuts of efficiency. You can't find new. You can find new operations for injuries, but in terms of mental health, it's one to one.
All
It
right.
is very personal.
Okay.
Yeah.
Thanks very much, Dr. Now, from a crisis in healthcare to a crunch